Surgeons, what was the biggest mistake you made while operating on a patient? My mother's surgeon, well, not doing basic math correctly and sewing up a woman having spine surgery with 2 sponges still inside of her. My mom was 20 plus years sober, so she refused most of the pain meds. When they had to confess, they freaked out. She had a mental breakdown facing all that pain again. She got a lawyer and they settled as soon as possible, about $50,000. Mom thought that was fair, but my godfather is a retired federal prosecutor and said it would have been $100,000 easy with another attorney. Update: want to thank everyone on behalf of my mom for the good thoughts. This happened about 15 years ago. My mother has a master's in biology and knows, well, crap happens. It's a testament to her character that she decided the settlement was fair for an accident. Yet another example of how extraordinary my mom is and how underappreciated this retired HS biology teacher remains. Not a surgeon, but I can tell you of one. My mother-in-law had a bad fall while on vacation in Florida and had to have hip surgery. During they nicked her bowels without realizing it until almost 2 days later when she started complaining of abdomen pain and her blood pressure started dropping. By then she was already septic, went into a coma, and they couldn't save her. The hospital declared her death natural causes. We only know otherwise because my husband's family hired someone to do an autopsy before they cremated her body. I'm not a surgeon, but an OR nurse. We were doing an APR for a patient with rectal cancer. Quick summary: you remove the rectum/anus, close the anus, and the patient has a colostomy for the rest of their life. This procedure was done robotically. The rectum was removed/detached and wasn't immediately removed, not uncommon. I went to lunch and when I came back noticed the lack of specimens on my table. The patient was already closed and minutes away from being extubated. The surgeon had to return to the OR, reopen the patient and remove the specimen. Big deal, but luckily no real harm to the patient. I've already wrote one, the one about the knee surgery, but here's another. This one is not a personal experience, but a case that I read and stuck with me. So, a surgeon amputated the healthy leg of a 52-year-old instead of the other diseased leg. He was already cutting the wrong leg when a nurse looked through the patient's file and stopped informing him that he had been working on the wrong leg. Apparently the surgeon denied responsibility for the error and shifted it to other staff members involved in the surgery, since the blackboard in the operating room schedule and the hospital computer all listed the wrong leg for amputation. Also, the wrong leg had also been prepared for surgery prior to the doctor's arrival. The surgeon added that he didn't realize that he was cutting the wrong leg because it was also diseased and might have needed to be removed in the future. A long time ago I worked for a law office as an administrative assistant. The office represented doctors who were going in front of medical board to defend their licenses when they were accused of violating medical conduct. There were surgeons who routinely left items in their patients over and over again, who kept getting let off. A doc who was forging paperwork for parents to show that they provided services to their kids when they were never provided, which caused an outbreak of disease and resulted in innocent people dying. There were doctors who were using their medical knowledge to poison family members. I obviously can't go into any detail, but that crap was terrifying. Most of them kept their licenses and faced no recourse besides losing a little money in a malpractice suit and getting their malpractice insurance raised and occasionally paying a fine to keep their license. There are a lot of good doctors out there. These were not them. Scary outcomes. 13 years in practice as a surgeon. Thus far, so myself haven't had any major operative F-ups. However, everyone who is a surgeon gets their training at some kind of academic medical center. The mentors at these places tend to be of two varieties: type 1, the highly competent role models, and type 2, surgeons just barely competent enough to stay in practice, but with their mistakes frequently reviewed publicly for educational purposes by the trainees, who also work at the same facility, so they can call those of type 1 for rescue help during the operation. By far the most common mistake made by type 2 surgeons is doing operations in patients that were beyond hope of recovery. This frequently results in suffering for everyone involved, and many times a more expeditious death for the patient with a terminal illness. A good example would be attempting to resect large unresectable metastatic cancers wrapped around sensitive vital structures. Some type 2 surgeons make careless mistakes, like how I watched a vascular surgeon that forgot to reverse the vein graft when doing a bypass, so that all the valves are pointed the wrong way and the graft doesn't flow. I also once saw a cancer surgeon use the ultrasonic dissector to accidentally divide the external iliac artery. Have heard about inadvertent vascular injuries to the iliac vein and aorta. All but the last of those were identified and corrected, with the patient suffering no adverse consequence. Lots of times bowel injuries are missed and the patient has to go back to surgery for a resection or repair. That's super common because the valve is pretty thin and fragile, and partial thickness tears can break down in unhealthy patients with a lot of previous surgery and lots of adhesions. Even great surgeons get leaks once in a while for all kinds of reasons, but most commonly overconfidence in a really sick patient's ability to heal a technically proficient surgery. Sometimes timing an operation or part thereof is the most critical thing. Having good enough blood pressure, heart rate, oxygenation, and nutrition are just if not more important for some types of surgery where functional organs are reconstructed rather than just being removed. There are some common sayings among surgeons, and one of these is it takes 5 years to learn how to operate, 10 years to learn when to operate, and a lifetime to learn when not to operate. Actual surgeons got into the wrong intermuscular plane during the initial approach to an anterior-based hip replacement and damaged the patient's femoral nerve. They have permanent paralysis of their quad as a result. The reason this thread is mostly full of joke answers and third-party retellings is that mistakes like this can be hard to talk about, even behind an anonymous throwaway account. Every time you put on the gown and gloves, there is a small, needling part of the back of your mind reminding you that there's a real chance you may be about to ruin someone's life. It may not be this time, it may not happen in any of the 12 other surgeries you have scheduled this week, or the 50 this month, or the 50 next month, or the 50 the following month. Major life-altering mistakes are extremely rare, but with enough time and a big enough sample size, rare things happen all the time. That's the reality of being a surgeon. People put their life and well-being in your hands, and at some point you are going to betray that trust and hurt someone. It is going to happen. There is no amount of preparation or care that can prevent it. If you chose this life, you have chosen a life where at some point you are going to lie sleepless in bed at night wondering, I wonder how Mr. X would be doing now if they'd never had the misfortune of meeting me. Not a surgeon, but I'm a histotech. We work in the pathology lab where all the specimens are sent. A surgeon did a double mastectomy based off a different hospital system's pathology report. Basically the report said she had the kind of breast cancer where both breasts need to be removed. But we found zero cancer in either breast. He was shitting bricks, so we submitted both breasts in their entirety. That's a ton of blocks and it's unheard of to submit all the tissue like this. But he needed to find cancer. I've never seen a surgeon stand there and watch the pathologist like this guy did. We all felt so bad for him and OFC the patient. He was so upset, cussing up a storm the whole time and screaming about this is why I never take outside pathology reports. Turns out the other lab had mislabeled her specimen, so some other lady got the all clear who had cancer and she lost both breasts when she didn't. All around horrible situation and the surgeon was sick over it all. Malpractice stories can be tough. I'll lighten the mood a bit. Was doing varicose veins surgery on a very posh middle-aged lady. Very cut class accent. There was an anesthetic that we used that sometimes induced some hallucinations either going under or coming out of anesthesia, and heard some funny things. Anyway, this lady was in recovery just coming out of the anesthetic. The team were around waiting for her to wake up and gag a little on the tube in her throat for breathing, so we knew it was time to remove it. She gagged, we removed the tube, she smacked her lips and said loudly, in her incredible accent, "That's the best bit of cock I have had in years." The whole recovery room just fell about laughing. Luckily she didn't remember it. Not the surgeon, and I'm sure not even sort of his biggest mistake, but this was one of the more bizarre things I've witnessed in an OR. Surgeon brought a bad pair of glasses. So here we are, total hip replacement. Surgeon is going to town with what I lovingly call their human grater, which is a doohickey, to make sure the new hip socket will fit in. Picture a cheese grater wrapped around a golf ball on the end of a power drill. It's not pleasant. Anyway, dude's grinding away at the fella's hip and suddenly yelps in surprise and stops, backing quickly away from the table. We're all like, the freak. His glasses spontaneously broke in half. They were the type that didn't have rims, just lenses with a bar across the nose and bars for the ears. So the metal crossing the nose snapped at the screw. Surgeon quickly starts stripping off his gown, etc. Had the full face shield get up, although ORs are splashy, and leaves the room. Comes back with a roll of tape. Him and the circulating nurse can't get them fixed, so he just holds them to his face and has her run the tape around his head a few times. Then suits up again and goes back to acting like nothing happened. All in all added like 10 minutes to surgery time, at least that I could catch directly. Hadn't been with that surgeon before, but I can't imagine that was his best performance afterwards, seeing as how his glasses were taped across his eyes at weird angles. But yeah, don't buy $5 readers for the OR. Not a surgeon, but I had a screw put in to hold together a fracture in my wrist. At the last moment before surgery, the anesthetist told me I could have the surgery with a local rather than general anesthetic as planned. So I let her make the call for me to be awake. During the drilling, my surgeon started complaining at length of why he hates the drill he's using and how it's inferior to the other type or brand. It was apparently the only one he could find at the time and he didn't want to reschedule. Once the screw is in, the surgeon says to close up. Someone asked if the screw should protrude as much as it was, to which he responded no, but we can get away with it, and you never want to take a screw out and put another in as you essentially wear the thread of the bone. Then silence for about 10 seconds while I feel them shifting wrist around, followed by actually we better put a smaller screw in. When I was in recovery, the surgeon was surprised how quickly I woke up and had a slight look of surprise when I told him I was only under local. Next thing he said was surgery went well. Veterinarian here. We do quite a few surgeries, so I hope this counts a real response. Mistakes likely happen all the time. From nicked blood vessels to skin/organ tears. Most are probably fairly minor. In the veterinary world, I've certainly heard stories of male animals having an abdominal incision during a neuter, since someone thought it was a female for a spay. Wrong limbs can be amputated. Surgical instruments and sponges/gauze can be forgotten in patients. There are many pre- and intra-surgical checklists to help prevent these, and I'm sure it is even more developed in human medicine. Fortunately for me, the biggest surgical mistake is probably a suture slipping when removing an organ, resulting in minor internal bleeding. Fairly easy to find the bleeder and get things stopped rather quickly. Or having a small bone break when repairing another fracture. Things happen. We address it and learn from it for all future patients.